So this is our wound care clinic. It was built by the local villagers in one of the villages that we've come out to. You can come on in. We have all of our wound supplies, all of our dressing supplies here on the bench. And then we have 2 tables so we can see 2 patients at a time. As you can see, the conditions are different from what you would see at home. This building was built by the local villagers. Quite fascinating to watch them do it. They built it, I would say, in about an hour. And so it's different conditions than what we're used to, but it works quite well. It shades us from the sun, but there is enough air flowing through that we do get a bit of a breeze as well. One of the patients that we are seeing is a young boy named Mark. He's 11 years old, and 4 months ago he had a small boil or furuncle on his lower leg, his right lower leg. Over time it festered, the entire lower leg became quite swollen to the point that the skin actually ruptured apart. He spent a full month in a local hospital. And during that time, they cleaned the wound and applied iodine to it, but unfortunately, he really saw no progress in that time. So he presented yesterday with significant areas of thick, separated flesh, skin that was quite thick and almost like a leather in texture. Yesterday, all of that dead skin tissue was debrided from the wound to get down to a healthier wound bed. So as you can see, it's a significant portion of his lower leg. So there's some healthy tissue between, but these areas were all debrided yesterday. After the debriding, we applied an ointment called Sontil to continue the debriding process. And then today, what we're going to do is use CPI, which is closed pulse irrigation. So it's a saline solution, and we use that to irrigate the wound, because oftentimes when the patients arrive, the wounds are quite dirty. So this process helps to clean the wound and also to bring circulation to the wound from the pulsation, and also remove the biofilm. So there's a layer that rests on the top of the wound that we can't necessarily see with the naked eye. This will help remove that and get us down to the fresh wound bed. What our hope is that over time, as the wound progresses, we'll be able to do a skin graft. And we anticipate that Mark will have full healing and very good results from his wound. He'll come and stay at the front step. So here he is applying the CPI. So it's a saline solution in a pulsating fashion that irrigates the wound bed. So today, after we removed the dressing with the Sontil, we cleaned the wound with the CPI and then did a little bit more debridement. There was a tendon that was partially exposed, so what we decided to use today was a hydrocolloid dressing instead. So that will keep the tendon moist but continue the process that we're looking for. So we'll reassess the wound in 2 more days, and hoping that we can prepare the wound bed for a skin graft. What Mark is going to do is, we're here in the bush where we meet the patients, and then if they're able to, they come back to reside with us. So Mark and his mother will be coming to live with us while we do his wound care on a regular basis. Before I arrived in Togo, my concept of wound care was greatly different than what I've seen here. At home, the wounds that I have seen were some small diabetic ulcers, post-operative wounds, but what I've seen since arriving in Togo are the entire limb or a significant portion of the limb. So whether that's a small scratch that then got infected with flesh-eating disease, leprosy, osteomyelitis. There's been a huge variety. Without the intervention of MMI, a lot of these wounds would have led to amputations, which, as you can imagine, would greatly change the future for that person.
That as their wounds heal, not only are their wounds healed, but their spirits are healed as well. And we saw a gentleman that was discharged leaving today, and he was cheering and smiling as he was leaving the building. So that's been really incredible to see, and really opened my eyes to the great work that MMI has done for the people of Togo.